Benign prostatic hyperplasia is an immensely painful, non-cancerous condition that men commonly can suffer with. This is where over time the prostate becomes enlarged and pushes against the urethra and the bladder. Well, that's how it's explained in the medical books, but you may well recognize it through its symptoms, which are normally noted by the need of frequently having to go to the bathroom or the burning sensation when urinating. Normally this can be treated by your GP, but if it's left too late or if the treatment isn't effective, then a urologist may well consider performing a transurethral resection of the prostate. This is where the surgeon has to take a look at your prostate through the urethra and remove that extra tedious tissue. Many studies have been done on the effects music therapy has on reducing anxiety in patients prior to having an operation. But apparently, or so the researchers have said, no studies have been done to measure its effect on patients scheduled to have this type of operation. Nor have they taken into account exactly what possible effects a carer may well have in reducing this anxiety. Here, a hospital in Hong Kong has taken up this challenge with 30 male patients due to go through this procedure. They were randomly placed into 3 different experimental groups, where one group had music therapy, another had a nurse present, and the third group, the control group, just had the standard treatment and care. Now, as anyone who has had an operation will know, the most stressful time when having an operation is when you are actually lying on the bed waiting to be wheeled into the operating theatre. It is there and then where all your fears can come to the fore, where your heart starts racing, you've got tension in the neck, and your palms are sweating. So while the patients were waiting in the surgical holding area before going in for their operation, they had their stress levels and their blood pressure and heart rate monitored. Now, those patients who were in the music group listened to 20 minutes of soft, rhythmic music via earphones before going in for their operation, while the patients in the second group had a nurse to keep them company. Although it has to be said that there was limited to minimal conversation between them. And the patients in the control group had neither music nor a nurse to help them through the traumatic waiting time. They just had to handle it all on their own. 20 minutes after the operation had finished, all of the patients had their physiological and psychological levels monitored once again. When all of this information was compared, the researchers reported that the patients who had listened to the relaxing music had radically reduced their blood pressure, heart rate, and anxiety levels compared to the other 2 groups. They concluded this study by stating that this study demonstrates that music is a preferred, perfect tool to be used for patients in hospitalization, and particularly in the preoperative stage, as it is so effective in reducing blood pressure and stress.